Hi, Sarah. I've been thinking about becoming either a nutritionist or a dietitian, but I'm not really sure about the differences. Could you explain?
Of course, Waleed. I'd be happy to help. So, first, you should know that both careers focus on health and nutrition. But there are a few key differences in terms of jobs, education, and responsibilities.
That sounds interesting. Would you mind telling me what kind of jobs a nutritionist usually does?
Sure, nutritionists mainly work with people to help them improve their diet and lifestyle. They may work in private practice, health clubs, or in public health settings. They provide general advice, but they don't usually treat specific medical conditions.
Okay, so they don't work in hospitals or clinics.
Well, there are some clinical nutritionists as well. However, it is more common that dietitians work in clinical settings. Because dietitians have special accreditation, they often work in hospitals, clinics, and other healthcare institutions where they manage and treat medical conditions with specialized diets and supplements. They use a therapeutic approach to help people with conditions like diabetes, allergies, or heart disease.
Ah, I see. So, is there a difference in the education required for these two professions?
Yes, there is. A dietitian needs to have a degree in nutrition or dietetics that is accredited by the Oman Medical Association or the relevant authorities. This ensures that they have the necessary credentials to work in clinical settings.
That sounds like a lot of work. What about nutritionists?
Well, nutritionists may have a degree in nutrition, but they aren't required to be accredited like dietitians. They can be trained in various ways, but their qualifications aren't regulated strictly. However, if nutritionists are members of professional organizations, they may have gone through training and earned a certificate that shows that they meet certain standards.
So, if I want to work with patients in a hospital or something, I would need to become a dietitian?
Well, you would need to complete your degree plus any required training for that specific role to get those clinical qualifications. Dietitians are responsible for assessing patients' nutrition and making sure their diets help treat health issues.
That makes sense. And I guess they also have specific professional responsibilities.
Definitely. Anyone who works in healthcare with people has a duty to make sure that the advice they give is accurate. Dietitians might have more legal responsibilities because they are more likely to work in healthcare settings. They need to follow public health guidelines and sometimes work as a part of a team to treat patients.
Wow, there's a lot to think about. I'll definitely have to do more research before I decide.
That's a great idea. Just make sure that whatever path you choose, you get the right credentials for it.
Thanks for the help, Sarah. I really appreciate it.
You're welcome. Good luck with your decision.